Welcome to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and this is where we take your calls all hour at 866-870-5752. That's 866-870-5752. And when you call the show today, you get a free book, Dr. Darrow's latest, which is called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And what we're talking about today is musculoskeletal pain. That's muscle pain, joint pain, tendon pain, back pain, neck pain, knee pain, even arthritis pain. But I'm going to let you, Dr. Darrow, just sort of say some more about that.
Well, it's very simple. It's a healing process that I discovered, right at the beginning of my medical career when I was at UCLA in my residency. There was a 1-hour lecture about it by a doctor, and everybody scoffed at him because he got up and said, I heal 80 to 90% of my patients. And we weren't healing anybody. We were just sending them to physical therapy. We were sending them to surgery and watching them get worse. So I listened to this doctor. I went to his office and talked to his patients and was absolutely in shock when they were telling me about these miracle healings that they were getting. I then had a wrist injury myself. You know about that, Nita, on the golf course.
Yes.
Slamming the ground instead of the ball. And it's called chunking the ball. For all you golfers, you know what I'm talking about. And I hyperextended my wrist, and it really hurt badly. It took me a while to learn about regenerative medicine. When I did, I injected my own wrist, and it is perfectly healed. I'm going to go play golf a little bit later today. And I haven't had a problem with this wrist for as many years as I can remember. I've used it on my shoulder. I had a shoulder surgery while I was doing orthopedic surgery in medical school, and that failed miserably, made it worse. And then I learned about regenerative medicine, injected my own shoulder. What else have I done? I've done both of my elbows, had them locked up. So my wrist, my shoulder, my other shoulder later, both elbows, both my knees, and I've had other people do the back of my neck and my low back, and I've had amazing success with these treatments. I used prolotherapy, which is sugar water in the old days. It didn't work anywhere near as good as what we have today, which are platelets from your own blood, those are your cells, or bone marrow from your own pelvis. We just drill into the back of the pelvis. Not too many people like that anymore because we have something much superior now, which are called umbilical blood stem cells. So we take purchased cells that are frozen, and we thaw them out. We mix them with your PRP, your platelets, and then we inject those, and we're getting the best results with those. We do have a research department at my office. We have 20 either students or postgrads who are wanting to get into medical school, and one of the ways that we can help them is we have them do research for us, and when they get their name on papers and we publish it, then the medical schools like that because it makes them look good, and we help people get into medical school. So if anybody wants the research, you can always call the office at 800-300-9300. I'll repeat it for you while you grab your pencils. The phone number to the office is 800-300-9300. Or you can just go to the website. We have research on the website, which is www.lastemcells.com, lastemcells.com. And if you have research questions, you can call the office and talk to our director of research. His name is Brent Shaw. And I like playing golf with this guy. He's 6'2", about 180, 190 pounds. And for you guys listening, he can hit a 2-iron about 260 yards. And he can drive the ball. I've seen him drive about 340 or so. So
That's amazing.
We have a lot of good information for you, a lot of research. People love the research. And do you want me to take a question right now, Anita?
Well, we have a caller. We have Steve.
Okay.
So let's take the caller, and then you can go to a question.
You got it. Steve, Dr. Marc Darrow, how are you today?
Well, I'm okay. I was just calling to see if you have a thought about platelet-rich plasma helping hair growth. There's an article in the paper about it today, and I'll hang up and just listen to your comments.
You can stay on the phone because I'll have questions for you if you like. In my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, there's a whole section in the back of the book on hair growth with the research with it. On my website, there is also a video of my wife, Michelle Darrow, who's a nurse practitioner, who is doing the procedure. And yes, it does work. It's not going to work very much for someone who's completely bald. Do you have hair left on your head as a thinning, or are you bald guy? I guess we lost Steve.
Okay. Well,
So if you're completely bald, don't expect to get a full head of hair back. But if your hair is thinning, then PRP or adding stem cells to the PRP are a magnificent way of thickening up the hair. We do a lot of people, and they're very, very happy with this. So yes, the answer is there is research on hair growth using a PRP, platelet-rich plasma, or stem cells, and we can send you research on it if you don't pick up what you need directly from the website.
okay. So our number is 866-870-5752. That's 866-870-5752. Remember to check Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com. You can email him off of every page on the site, and you can also see him performing the treatments on video. So give us a call right now, 866-870-5752. It's so interesting, Dr. Darrow. We just have all this hour, like 58 minutes, and everyone calls in the last 10 minutes.
And
So-
then we don't get to talk to you because you're all lined up. So please, 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 call now.
Exactly. So you were going to take a question?
Yeah. This one, it's an email that came in very recently, and actually came in yesterday. And I won't mention the name of the person. It starts like this. Wife's cousin. So it says, a wife's cousin has spinal stenosis. That means that the nerves coming out of the spinal cord through the vertebrae, the foramen, are being squeezed. I told her that your procedures may not work for that problem, but they often can too, but suggested that she visit you before submitting to more surgeries. She's had too many possibly avoidable back surgeries already. I told her I had a great result with you and that she could trust your opinion. Any thoughts on spinal stenosis and various forms of regenerative medicine? Absolutely. Most cases of spinal stenosis do not cause pain. Now, I have spinal stenosis in my cervical spine, in my neck, and that doesn't give me any pain. Okay? So go figure what's going on. The problem is we get a MRI and it shows things that don't necessarily cause where the pain is coming from. So be very, very careful not to be getting a surgery based on an MRI. Now, if someone has spinal stenosis and they're having pain down their arms or legs, that could be a problem that you need surgery for. But most patients that I see that have spinal stenosis have more of a ligament problem that doesn't show up on the MRI or X-ray, and we can fix those. So I can tell this person within literally 1 minute of just touching the neck, or if it's the low back, just touching it and seeing whether their spinal stenosis is causing their pain. And 9 times out of 10, it is not causing the pain. It is something that's an ancillary condition that has nothing to do with the pain. So please be careful not to get a surgery unless you have to do that. If it's an emergency, go for it. If it is elective, don't do it. The elective things I can usually heal by just injecting the area with your own platelets called PRP, or bone marrow stem cells, or umbilical cord stem cells. And the study that we are doing, we're putting together a giant study. So far, it looks like the bone marrow patients and the umbilical cord patients mixed with PRP are doing a little bit better than the bone marrow. So why would you want to think about doing surgery when we're getting people better without it? It makes no sense. There's too many dangers in having surgery. We want to stay away from it. People say it's a last resort, but most of the time it's not a resort at all. It's something that causes problems. There's a woman that called us up a few months ago whose husband had a surgery a few days before the show. And do you remember her, Anita? She started crying on the show that her husband was intubated. You know, he had a breathing tube put in immediately during the surgery because something bad happened. And I have terrible news for everybody if you heard that show. Her husband did die. It took a few months, and he just went out. All kinds of procedures and, you know, supposedly a simple neck surgery, but it didn't turn into that. The poor guy actually died. And
very sad. He wasn't that old either.
No, it had nothing to do with age. It's just that it shouldn't have been done in the first place. You know, these surgeries are dangerous. And I don't care if it's a knee surgery or toe surgery, they can be dangerous. Surgery is dinosaur medicine. It's something we should stay away from unless it's an emergency. Look, there's a lot of surgeries that have to be done. I'm not putting that down, but most of them should never be done. If you even Google surgery in orthopedics, you're going to see that most of the studies show it should not be done. You can do a fake surgery or a real surgery and they come out the same. So why get the surgery where you can get infections or terrible things can happen when you don't need to? It makes no sense to me.
Exactly. Shall we go back to the phones? I've got Cedric in Huntington Beach.
Absolutely. Cedric, Dr. Marc Darrow, how are you today?
Dr. Darrow, how you doing there? Hi, Anita.
Hi there.
So,
Hi there.
Cedric,
Great.
you have a stiff neck and it's cracking shoulder, also hip pain.
Oh, well, yeah. The good thing is that nothing is chronic or severe, but my neck is not only stiff, but it cracks if I, turn left or right. I had a shoulder impingement surgery, like you did. Big mistake. So I have cracking in the shoulder. The right hip area, just around the thigh area, it's when I rotate, there's pain in that area. And, of course, I have plantar fascia also on the right side. So,
okay.
So one of my questions is it unusual for all of these conditions to be on one side of the body, and
no,
what can be done?
It's not unusual at all. There's very few things that are unusual when it comes to medicine. To me, one of the most unusual things is, let's say I have, my average day is about 15 patients or so, and I'll have 4 people in a row that have right knee pain, that have right knee osteoarthritis. What's the odds? Sometimes in 2 different rooms, I'll have people with the same exact problem back to back. How does that happen? I don't know. But no, it's not unusual that you have, you've mentioned 4 things: your neck, your shoulder, your right hip, and your right plantar fascia on your right foot, all on the same side. No, I see it all the time. Personally, I've had a lot of things on the left side of my body, but I've had things on the right side too. And everybody's just different. It depends in sports, what you're doing, depends on what the sport is, the activity is. And the big question is, can I help you get better?
Yes.
Okay. And it sounds like all of these things can be helped using regenerative medicine, using your own platelets from your blood or adding some umbilical cord stem cells to it if it's severe enough. I have to touch your body and examine it to tell you if I can help you. The diagnosis doesn't do me any good, and your description on the radio is helpful, and it lets me think I can help you, but I'm not sure. I'm never sure ever, even after I examine, because I'm not the guy who does the healing. Spirit does the healing. You know what I mean? But
yes, I do.
But
I have a follow-up question for you.
Sure.
Would you recommend, after the orientation, would you recommend doing all areas at one time, or do you work in one area and then work on a second area, third, fourth?
It all depends on.
For this?
Yeah, it all depends, Cedric, on the circumstances of the patient. If we have someone who flies in, let's say yesterday I had a man fly in from Saudi Arabia with his family. I treated his daughter's hip dysplasia. She's 25. And I did one stem cell treatment on her, I think it was, I forget, like 3 weeks ago or something like that. She was, I think, 50% better after major surgeries on her hip that made her worse, okay? Now, the dad watching this decided yesterday to get both of his knees and his plantar fascia injected, okay? I have injected entire bodies where people, when they fly in, and they don't have an opportunity to stay to get different treatments, will do many, many joints, many areas, many rotator cuff tears, meniscal tears, whatever it is, different arthritides. So it just depends on the circumstances. If you're local, you may want to just do one area at a time if you can get in real easy. But most people around LA, because of the traffic, don't want to keep driving over, so they're going to just knock it all out at one time. And the problem is, it often takes more than one time to heal. So if you're going to end up having, let's say, 3 treatments of 4 parts of the body, you'll probably want to do all of the body parts at one time. But that's going to be something that you and I talk about, and you make the decisions. I never tell anyone they have to get treatment. And a lot of patients get mad at me. They go, would you please tell me you're the doctor? I go, no. My job is to educate you. And your job is to decide what you want to do. I'll help you make the decision. So I get so many people that come in and they've been to a different doctor or a chiropractic seminar or something like that where it's a money deal. And they're told they have to get this right away or they're going to get old and never be able to do it again, or they're going to go downhill or whatever that is. I don't do that. I'm busy enough. I've been doing this for over 20 years. I don't need to hustle anybody, and I refuse to hustle people. Every time I tell someone I think they should get treatment, I have to look inside my heart to see if I'm doing it for the right reasons, okay? I do this as a spiritual work.
Prevention and intervention, so I just live about 40 miles away. So for me, I'd be glad to come in, periodically, whether it be monthly or 3 months or 6 months, whatever you would, decide is best for, these different conditions here.
Well, Cedric, let's do it this way. Number 1, take down the phone number to the office, which is 800-300-9300, easy to remember, 800-300-9300. Call up right now or anytime. We have people by the phones most of the time, even right now, and find out if we take your insurance. We do take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, and United Healthcare. And if you don't have insurance, we take Care Credit. It's like a credit card we can help you get. Now, just because we take your insurance doesn't mean that we take the specific form of your insurance that you have. So you have to call and get an insurance verification. Then come in for an examination. Let's see if I can help you at all. I'm not promising I can help you. I need to examine the area and see if I can help you.
Dr. Darrow, can I ask you one other quick question?
You can ask me 1,000 questions.
Well, good. I'll take all hour, okay?
Yeah, you can do that. You're a good guy.
My girlfriend, she has trouble with her right shoulder blade. She has an itching sensation inside, and sometimes it feels like she has a poking, like a needle poking, and a burning sensation.
Yes.
And it's moved from the inside the right shoulder
Yeah.
to the left shoulder. Is that anything that you can? Does that make any sense at all? Or
Yes, absolutely. It's common. And it's healable in most cases. I'd have to examine her. If you come in for an appointment, you can just drag her with you, and during your appointment, I'll just touch her spot, and I'll let her know in about 2 seconds if I can help her. From my experience over 20 years of doing this, these things heal up very easily. And that itchy thing is something very, very common when there's an injury. Okay? And it usually goes away when we treat the underlying problem.
great. Okay, well, we'll both come in and see you ASAP. Thank you so much for your time. And
God bless, Cedric.
And I appreciate your show and everything.
Thank you, Cedric.
I hope you call back again. You're a good man.
Thank you so much.
Thanks a lot.
Okay, bye. Our number is 866-870-5752, 866-870-5752, and we're going to Jerry in La Puente.
Hey, Jerry, Dr. Marc Darrow. I'm looking at the call screening board on the computer. It says you just had stem cell therapy done on your thumb. Was I your doctor?
Correct.
Okay.
No, you were not my doctor.
Oh, I was not. Okay.
No, I had stem cell therapy through another office in Beverly Hills, actually. And
Okay.
I actually called your show like a couple of weeks ago and talked to you about this. And you gave me your number, and I called your office and left like 3 messages, and nobody ever got back to me. I could never get a hold of anybody in your office, honestly.
Okay. That's
Maybe I
very,
called you
very,
the wrong
Jerry,
time.
that's very unusual because we have 10 people who check those phones all the time. And I'm going to tell you what I hear commonly. People will email me and said, I tried reaching you so many times. I check with my staff, and they keep a list of the people they call. And they'll tell me they called, left a message, and the prospective patient never got back to them. And I'm going to bet you anything you want, we contacted you more than once.
Well, I'll tell you what. I'm going to call again and leave my information, and we'll see if somebody gets back to me. That's fine. Anyway,
Well, why don't we do, Jerry, why don't we do this? I'm going to give you my cell phone right now. It's 310-666-9977. That's only for you.
Well, I'm driving to my... Hold on a second. I'm driving to my car right now. Hold on. Hold on one second. Okay, go ahead. What is it?
310-666-9977. That's my cell number. You call me anytime you want, and I will personally take care of you. How's that? And
Yeah,
I'll get you in the office whenever you want.
You got it. I appreciate that. Okay, listen, I'm just getting it on my notepad right now. 310-66 what?
We got to go.
Sorry.
Hang on,
Yeah,
and
fine.
we're going to the break.
Okay. Thank you, Jerry. Appreciate your call. You're listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here, right now, 866-870-5752. So give us a call, and when we come out of our little break here, we'll pick you right up.
Thank you, Anita Valens.